So, welcome to today's session. This session is titled Adult Lower Risk Drinking Encore Community Resources for Supply, Demand, and Risk Reduction. I'm Sarah Kondrak, and I have the pleasure of hosting the first Echo Hub dedicated solely to supporting the behavioral health prevention workforce. There are over 1,500 Echo Hubs in more than 200 countries, and we're just really proud to use this global model here in Ohio to strengthen prevention practice. This Encore is a special opportunity to bring our community back together after our original 6-session adult lower risk drinking series, which wrapped up in March. Over the course of that series, we explored the complex landscape of alcohol use in Ohio and shared practical strategies for supporting our healthier communities. Today, we're going to build on that foundation by focusing on how supply, demand, and risk reduction strategies intersect and how we can promote lower risk choices. So thank you all for being here to learn, share, and continue in the important work we're doing together. This Echo Hub is housed at the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, and we welcome you to visit the website on the slide to learn more about all the work that the center has done. The center is funded by the Ohio Department of Mental Health and Addiction Services and administered by the Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute for Research and Evaluation, or PIRE. So many of you have attended our previous sessions. This is an encore session. But if this is your very first time at an Echo, welcome. We're really happy to have you here. At the heart of Project Echo is the philosophy of all teach, all learn. Each session starts with a presentation from an expert on a topic, followed by a community member sharing their work and experiences. The reason Echo is so unique and effective is that everyone here brings their own knowledge and experience, their own backgrounds, and we'll have an opportunity to learn from one another. A key benefit of Project Echo is that the model really quickly democratizes access to information and expertise. This means that no matter your location or how big your professional network is, you'll have access to the latest best practices. Echo ultimately builds our workforce capacity by empowering professionals across different sectors with the skills and knowledge that they need to make an impact in their own communities. So some practical tips for today. Please mute microphones when not speaking. It is lunchtime here in Ohio. But if possible, please turn on your cameras. We'd really like to see your face. These sessions are intended to build connections and relationships with our colleagues. I encourage you to use the chat feature throughout the session. We'd love to see any resources that you have or any work that you would like to share. And then we will capture those resources and put them into some notes in iEcho for you to follow up on. Finally, please reach out to my wonderful colleague, Nancy Clough, if you have any tech issues. She just put her contact information in the chat. Okay, so we have an incredible hub team that's responsible for ensuring the series meets your needs. You can identify us by the white background and the Echo logo. And we are really committed to creating an inclusive environment by providing all necessary accommodations. We will start and end on time. And the only recorded part of the session is the didactic presentation. This is out of respect for your privacy and the privacy of the community members that you serve. So we also ask participants to help create a safe and respectful learning environment by valuing the opinions of your colleagues, using inclusive language, and protecting privacy of everyone involved by keeping discussions confidential. We'll encourage you to be open in sharing your experiences, knowing that this is a supportive space. And with that, I would like to introduce you to our didactic presenter, Maureen Busalaki. Maureen is the director of the Division of Alcohol Policy, Prevention, and Research and Wisconsin Policy Project at the Medical College of Wisconsin. And she has decades of experience in public health policy, including serving as an alder in her local community. She currently is co-chair of the Wisconsin Public Health Association's Public Health Affairs Committee and served as chair of the ad hoc work group on alcohol prevention for the State Council on Alcohol and Other Drug Abuse to keep evidence-based recommendations to reduce excessive alcohol use. She ran Smoke Free Wisconsin and led successful smoke-free air and tobacco tax campaigns. Maureen presents at state and national conferences on advocacy, systems change, and public health issues. Welcome, Maureen. We're so excited to learn from your experience and your expertise, and we love seeing your bill behind you.
Thank you. Thank you for your kind introduction. I'm really excited to be here today. So just quickly, I'm at the Medical College of Wisconsin. I work in the Comprehensive Injury Center, which has a statewide focus, and we work on suicide healing and prevention, community safety, overall injury prevention, making sure people have good data and information about what's happening in their communities. And then, like Sarah said, I run the Wisconsin Alcohol Policy Project, which is our community-facing part of the division. Today, we wanted to talk about identifying ways communities can reduce access to alcohol through policy and local action, and describe approaches that reduce demand and risk by promoting healthier choices. So I've got good news to start. I think views are changing. The most recent Gallup poll has shown some of the most reduction in views about alcohol and drinking behavior that we've seen since 1958. So we're really pleased to see this change. And we also know that some of this change is from our younger folks that are drinking less. So there's still the subgroups that are drinking much more, but I think it's important to recognize, that the public opinion around this has really changed in the last decade. And so I think that's a great thing and a real advantage for the work that we're doing. So while this is Wisconsin, the bottom line is the nation. And as you can see with the behavioral risk factors survey, I know I'm missing an S or an F on that. I'm sure most of you are familiar with it. We are seeing that decline in consumption. Now, Wisconsin has some issues with that, and we hang above the national average. But overall, we are seeing lower numbers for consumption. And alcohol deaths are slowly decreasing after COVID. They're not there yet. So the alcohol-induced deaths are the bright orange line on the bottom. And you can see that it's starting to come down, but it's not back to pre-pandemic levels. So we like the trend line, and hopefully it will continue to go down. So next, I wanted to talk a little bit about some items that are coming up that I think we have an opportunity to really share information and change the narrative around alcohol and continue moving in the direction that the public is in terms of alcohol and their use. So I'm sure many of you have heard about the dietary guidelines that are coming out on alcohol. And this process started 3 years ago. So every 5 years, they update dietary guidelines for food and all of those things, but also for alcohol. So while I know this slide might be a little bit hard to see, essentially what we wanted to show is that there were 2 reports that were being done to look at the dietary guidelines. One is the ICPUD report with under SAMHSA, and the other is the National Academy of Sciences report. So they both started in 2022 and then, worked through 23 and 24. And then released for public comment in 2025. So there was an opportunity for the public to weigh in as well as anyone else to talk about what they thought about the guidelines or about the research that was in those reports. So I don't know if folks have had a chance to look at those reports in the past, but we can pop into the chat a little bit more about the timelines. There's two links that we'll share talking about the ICPUD report as well as the national academies. So why is this important? Because the last step in this process is for HHS and USDA to release those dietary guidelines. We had expected that to be done in August of this year, and it's been delayed. However, we have it on good authority, and there's media stories on this as well, that they're going to change the guidelines to something that's pretty vague, to say drink moderately. Now, remember, we're at a time where the public's really paying attention to this. We had the Surgeon General come out in January, talk about cancer. There's been a lot of reports debunking, like the red wine study, and other things. And so the public's understanding of these risks, I think, are really important. So at the Wisconsin Alcohol Policy Project, we are getting ready for a response. And so this is one piece that we're going to be sharing out around our state. And we've been working with our state health office, local health directors, and substance use coalitions all over the state. So what were those recommendations? As you may recall, the CDC had clear recommendations on reducing or what excessive alcohol use was. And that was drinking no more than 1 drink per day for women and no more than 2 drinks a day for men. It also included binge drinking, which is 4 to 5 drinks in a single setting. And that is because that amount of alcohol over 2 or 3 hours will get you to the 0.08 blood alcohol content. So you're legally intoxicated. I believe at this point in every state, some states are looking to bring that blood alcohol content down to 0.05. The other two pieces are no drinking for women who are pregnant and no drinking for underage, which I think this group probably knows a lot about in terms of what that does to the adolescent brain. So the new proposal is drink in moderation, no numbers. So this is a big concern to have vague advice like that. I don't know where it is like in the rest of the state, but in parts of Wisconsin, it's moderation might be just a 6-pack a night, so not having clarity is a real problem in the narrative. And this is an area where we can all change the narrative around alcohol. And I think it's something we need to lean into. Again, this is an example of something that we are going to be putting out as a response to the dietary guidelines whenever they are released. So if you haven't had a chance, there's some really interesting pieces that have come out about the dietary guidelines. So the New York Times had a story, I believe it was on September 5th, talking about how the ICPUD report is being withdrawn. So they're only looking at the National Academy's report. This in the yellow comes from Vox, where they talked about how, there's this really strong connection between alcohol and cancer. And there's not a word about that in these guidelines. So in the past, there was like an explanation and information. It's our understanding again that they're going to say drink in moderation. So why is this a problem? Well, the NASM, the National Academies report, has had alcohol industry influence. This has been documented, where they've added another researcher. So this talks about, about that. And the NASM report talks about, and that's the recommendation about moderate drinking. And the study really looks at people who are drinking 1 or 2 drinks a day and then comparing that. to all deaths. So there's some challenges with the science in there, and they also excluded a lot of studies um, in their look at it. Whereas the ICPUD report, I think, was a pretty vigorous report, and it didn't exclude studies in the same way. It looked at a lot of studies, and you know, we we might want to say from our standpoint, it's easiest to say any, a lot of people say any alcohol, um, has risk, right? It's true. It's got carcinogens in it. Um, but there are a couple small pieces where drinking on a very low level could be potentially helpful around a stroke and I believe around diabetes. But it's definitely outweighed by the evidence of everything else that alcohol does in terms of harm. So that report talks about that as well, the ICPUD report. So what does this all mean for us? And why am I spending so much time on this? Um, it's really because it's important how we talk about these things. And I think it's important to prepare both a response as well as to be able to have information up on your websites around the country about what the science shows. So this creates an opportunity. By working together, we can change this narrative and we can continue moving the public in looking at alcohol as something that, if you do drink, to make sure that people are really drinking at that very low level, and educating decision makers and the public. And when I say educate, it's making sure they understand what the science shows, and the public in digestible pieces. So I hope that kind of gives you an overview of this opportunity we have to respond to these guidelines and then also to continue to talk about them and to share, kind of a public health approach to this. So when we're looking for solutions to reduce overconsumption, obviously communications and narrative is a big piece of that. But we look at the community guide, which I'm sure many of you are familiar with, and they've got their top reasons or top things that have shown a lot of study, as well as we did a report in Wisconsin with our state council on alcohol and other drugs, showing what works. For Wisconsin. And the reason why I say that is we have state laws that don't allow certain things. So, like the dram shop liability, which is recommended with high evidence, um, we are not able to do in Wisconsin. So, we did a report looking at the evidence and what is feasible and possible in Wisconsin. So as we did that, we narrowed down strategies. There's 61 recommendations in our report, so it wasn't like we didn't have a lot to say about it. But some of the strategies that we find to be effective, and when I say effective, there's some evidence or evidence base for these, evidence informed. But it also strengthens partnerships in many ways because really we need to be a community working on these issues. And that's, I think, how we're going to change things. What I mean by that is our substance use coalitions, our public health departments, our law enforcement, our city councils. Um, and in some cases, you all work with your state legislature. It depends on whether or not you are an alcohol control state or whether you have local control. In our case, we're a local control state, but these same things are true, on the state level. So one of the pieces we do is compile place of last drink, and I'll talk about all of these in a minute, talking about reducing density, conducting alcohol age compliance checks, sober server ordinances, the increased use of SBIR or SBIRT, depending on your funding and what you can do, and of course, increasing alcohol prices. So alcohol age compliance checks is, a well-known evidence-based way of reducing access to alcohol. It's also shown to reduce crashes among our youth, fatal crashes, which is critical. So this is generally done with law enforcement, with your public health department or substance use coalition, interested individuals, and obviously youth and getting them engaged in this work, as well as making sure that whoever determines licensure is engaged. So meaning a licensing committee or your state, board, whether that's ABC or whoever handles those kinds of things. Um, we we know that this is the kind of thing that works, and it really does help build some of these relationships that help strengthen the coalitions. Sober server ordinance. I'm sure many of you have heard of this in the past. It allows um, state or a community to make it illegal for someone who is serving or selling alcohol to be intoxicated. Um, in our state, there's no state law, but we have multiple local laws on this. And we actually find when we talk to bar owners and liquor store owners that they appreciate it um, because they find that people don't overpour as much. There's less fighting because part of the job of the bartender is to keep things calm inside the bar. And they're less able to do that, excuse me, if they're intoxicated. So this can be a helpful thing. Again, it's a collaboration and something that you want to engage law enforcement on. Generally speaking, these are enforced if there's some problems at the bar, not necessarily law enforcement doing checks on that. But some agencies do bar checks on a regular basis, and so then it would be possible to check for that as well. Place of last drink. So this is being able to gather data about where overservice is happening working with law enforcement. So we are in October of this year in our Badger Track system, which I believe law enforcement across the state use tracks, we'll be able to document when they pull somebody over where they were. And we have found this to be really interesting in terms of one place was the tubing company and people coming off the Sugar River. And that was the biggest source of OWIs for that community. Now, if you don't have the data, you don't know. This is anecdotal data, and we are going to be working to determine what is the best way to implement this by using 10 pilot communities. So again, this is not the end all be all, but this is a place to start to recognize overservice and again, help contribute to that community narrative about not overserving, not selling to kids, not overserving, really trying to change that alcohol environment. Um, so we're looking forward to how that turns out and learning a lot from law enforcement agencies and public health agencies working together. And then I'm sure many of you, again, are familiar with SBIRT as well as screening brief intervention. I know some funding does not allow for that referral to treatment. Um, so we've have, the evidence is showing that this can be really helpful in preventing or reducing excessive alcohol use. There is payment for Medicaid and Medicare of this, but it's only minimal and it can be time consuming. But there have been several studies done on this, and it does show savings over time. And it's a way of preventing people for needing that treatment down the line using motivational interviewing as part of this. And we encourage SBIR to be used in court systems. Like the first time juvenile gets an underage drinking ticket, this is a great time to start talking about this. Schools use it, healthcare settings, And we think not enough healthcare settings are using it. And then you need that health educator to help kind of bring that home if you're in a healthcare setting. But it has been effective in reducing alcohol and drug use in teens. And of course, raising the price of alcohol, there's multiple different ways of doing that. Every 1% increase in alcohol price decreases about a 0.5% usage, so consumption. So that is a really important piece. Um, and having, when there's areas of high density, they compete at times on price, right? So if they have to have their price a little higher, that's going to help in that and reduce overconsumption of alcohol. And then reducing outlet density, I'm sure you all are well familiar with that. And when you just have too much, you have too much. So just think of it, if we had donuts sold everywhere that you went, we would all eat a lot more donuts, right? We have alcohol sold, at least in Wisconsin, in our gas stations, grocery stores, our convenience stores, our Targets, pretty much everywhere. And that's a problem, right? So looking at how all the places that sell and serve and slowly bringing those numbers down can be helpful. Um, and then talking about healthier choices, and I know I'm just about out of time here. Um, we also look at what are some of the new activities. So this is where we partner with a number of different organizations, thinking about new activities for both adults and kids. And what can they do? Are there hikes, nature walks, and just trying to really change the norm about what people do when they get together. um, Making sure there's non-alcoholic offerings. Maybe there's events without alcohol. Wouldn't that be great? I have a question by mocktails because for certain populations, there has been some emerging evidence to say that it's not helpful. So if you're new into recovery, mocktails might not be the way to go. It could also normalize cocktails for kids. So there's some caution in using this, but if people are drinking mocktails, to either reduce or eliminate alcohol usage, that's where that positive part of that can be. But I would use, think about those options carefully. How we can gather as a community or for cultural activities is really important. Do we have alcohol everywhere or do we keep it confined? And I think that's important. And then sporting events, we're really seeing a lot more sporting events support non-alcohol areas, which I think is a step forward rather than everybody drinking all of the time. And if you're in recovery or you don't want to be partaking, you're just surrounded by it. And so even the Milwaukee Brewers had a sober tailgate the other day. So we're excited about seeing those kinds of things happening, which can help. So lots of challenges. I'll just leave that here in terms of, that community buy-in. Partnerships are incredibly important. I do focus on prevention. And I know there's a lot of things to do in the intervention, treatment, and recovery area. And we have a lot of changing social landscape to think about. And so there's my information. And I'll turn it back over to Sarah.
Wonderful. Thank you, Maureen. That was, I'm going to use what you said about donuts, I think, in my practice. Donuts are sold everywhere. We'd all eat a lot more donuts. But really appreciate you laying out some of the federal landscape, sharing Wisconsin's approach to prevention in this space. I think we can all take some of these best practices to implement into our work.